Hello people, in this video we want to learn about metformin. So basically metformin is a anti-diabetic drug. What is it? It is an anti-diabetic drug which is taken orally. So you're able to see here, right? It is a tablet. So it is an oral anti-diabetic drug. It is not called as hypoglycemic agent. That classification is not there now. Oral hypoglycemic agents we used to say before, but now it is a oral anti-diabetic drug. So where will you use it? Focus people, this metformin topic is very important because it is so widely in use and it is available in many combinations, okay, with other drugs. So it is used to treat type 2 diabetes. Which diabetes? Type 2 diabetes mellitus, not the type 1. Because type 2 diabetes mellitus is having insulin resistance. To overcome that insulin resistance, you are prescribing metformin. Okay. What classification does it come under? Metformin comes under this classification of oral anti-diabetic drugs. It comes under this one, overcome insulin resistance, Bigaunide. What is it? Bigaunide, AMPK activator. Example only one is there, metformin. So it's a Bigaunide. Okay. So what is Bigaunide? Bigaunide means some two compounds are groups are there like this, and in this case some two methyl groups are also attached. So this is the exact structure of metformin. But anyways, now coming back here, so what is metformin? It's an oral anti-diabetic drug. It is used to treat type 2 diabetes mellitus. It helps overcome insulin resistance. It comes under Bigaunide, AMPK activator. This much you understood, right? Now we told you that metformin is very important. Why? Because it is prescribed so often. Correct? But other than that, understand that why is it so famous? It is famous because it is a euglycemic agent. It doesn't cause much hypoglycemia. Let us say the person has taken tablet and not eaten or something, right? You will hear cases of hypoglycemia. This one doesn't cause that much of hypoglycemia unless you have taken overdose of it. Okay, so that's why they're calling it as euglycemic agent. And that is why now this oral, what was called as earlier as oral hypoglycemic agents, are you here with us? Earlier it was called as oral hypoglycemic agents, correct? Now it is called as what? Oral anti-diabetic drug. Okay. And oral antibiotic drug. Thank you for zooming. Okay, now let us go to this, back to this. So what are the benefits of metformin? Why is it so famous? So it improves lipid profile. So if a person is having obesity, right, as a prevention itself, you can give off metformin if he has impaired glucose tolerance. So did you understand? It improves lipid profile, cholesterol levels and all improve. It can be prescribed in pregnancy. It can be given in pregnancy. So you have heard of all the diabetes forms in the forms of diabetes in pregnancy, right? In those people who, diabetes you can treat in pregnancy. However, in after childbirth, this is secreted in milk. So there you have to be cautious because it can cause hypoglycemia, right? Not much unless there's overdose. That point you remember. Now let's focus here. It can use not only to treatment of diabetes, it can also be used to prevent. Okay, in whom? In an obese middle-aged person with impaired glucose tolerance. That means this person is not yet diabetic, correct? So in these people, to prevent type 2 diabetes mellitus, you can use. Okay. Now in infertility, if it is caused because of PCOS, what is PCOS? You know all that cycle, right? So obesity, insulin resistance, and androgen, right, excess androgen, etc. Polycystic ovarian syndrome, which leads to infertility, correct? In those people, metformin is given to overcome the insulin resistance so that these people will be able to get fertile, get pregnant. You understood, right? So metformin has a lot of uses and it is very famous. It is orally taken, so it is very easy, right? It is not metabolized by our body. Wow, this is interesting, right? You're taking something orally and the body is not metabolizing it. Then how is how is it excreted from our body? Via kidney. So this is very important to know. Touch your kidney here, yes, and say that metformin is getting removed by my both kidneys. Okay, it is not metabolized. So kidney. So you should not prescribe metformin in who have kidney failure. Okay, that much you understood. So metformin is so nice, the story, correct? Now understand how it works. How does metformin work? So main thing you know is it helps in overcoming insulin resistance. This point is important. How does it help in overcoming insulin resistance? Focus on this point for now. It is going to do this AMPK activation okay, by which it promotes the uptake of glucose. So the skeletal muscles, now please understand here, who is taking the all the glucose? We'll draw on muscle here. This is the muscle. All the glucose is being uptaken into the muscle and stored as glycogen, okay, via insulin. So who is making this insulin work? It is metformin. Okay, why? Because metformin is doing some AMPK activation, some magic it is doing there and making this insulin work, which was not working, correct? So you understood. So, so what is this AMPK? Activated protein kinase, they are saying. But what is M that I didn't find out? You find out what M is, okay? So, this is the main function, right? Overcome insulin resistance. Very good. So, coming to other ways that it will help. Here you see reduced lipogenesis. So, lipid also it is helping. That's why it's improving lipid profile, that you understood. Now, coming to the first point here, it less of glucose from liver. So, the liver which is producing, if it is producing glucose by gluconeogenesis, it will suppress that. So, less glucose. So, you understood, right? The whole problem is that there is excess glucose in this person. So, whatever glucose has to come out of the liver, that it is putting a stop to that, okay, and so the glucose output from liver has been reduced, okay. Then whatever insulin is whatever glucose is there, it is being uptaken into the skeletal muscle. Guys, are you with us? So first reduce the input of glucose from the liver, then make whatever glucose is there to be taken up by the skeletal muscle, right? And then it promotes glucose utilization by the body, that also it is doing. And so that means this is not just for the muscles, other things also. Then less absorption of glucose from intestine. So again, the input of glucose is also reduced, okay. So one thing you have to note here is metformin has nothing to do with pancreas. That much you got? Very good. So it is working on what and all? It is working on the liver. Looks like some effects on the liver, skeletal muscle, on our intestines. I will draw intestine like this. This is large intestine though. Don't get confused. Just intestine, remember. And then it is getting removed by the kidney. Correct? So all these things are affected. Have you seen pancreas anywhere in this picture? No. So metformin has nothing to do with pancreas. Okay? Very good. Now, we'll ask one question here at this point. At this point, I will ask you, which will reduce insulin resistance? Metformin. Very good. It will help in overcoming insulin resistance. Do you know something else which will help overcome insulin resistance? Look at this. See here, overcome insulin resistance, if you observe, there's one more category here. That is pioglitazone. Okay. But in this video, what are we focusing on? Metformin. Very good. So now, shall we resume, people? Now look at this, everything about metformin they have tried to summarize in this table. Looks like metformin half-life is around 2 hours. Zoom please. Zoom. So half-life is around 2 hours. Then daily dose you can give up to 2.5 gram. Okay. Clearance route is kidney, that you know. Duration of action, it acts for around 6 to 8 hours. It does not cause hypoglycemia. It is not metabolized by us. It is removed by kidney. And so if the person has kidney disease, you should not give. Otherwise, it will cause what? Lactic acidosis. Lactic acidosis. Please write one D here. Acidosis. Okay. Who is causing all this? Metformin. So look at the adverse effects. It will cause vitamin B12 deficiency and rarely lactic acidosis. Rarely lactic acidosis that you saw. In kidney disease especially it can cause, and in alcoholics it can cause lactic acidosis. Vitamin B12 deficiency is another thing that it causes. So that's why what they do know, when they're giving metformin, sometimes combination tablets are available, but metformin is available with vitamin B12. So metformin causes vitamin B12 deficiency. Along with metformin, in free they are giving vitamin B12 also. Understood, no people? Yeah, where are we? We are looking at what? Adverse effects of metformin. Very good. Now, all other, if they ask adverse effects, first thing you will write is definitely hypoglycemia you will write, and then you add off one rarely with it. Okay. And common side effects you will always write, like nausea, hypersensitivity, all that you write. Okay. Then it is secreted in milk. It can cause hypoglycemia in the baby. Okay. Now look at the contraindications of metformin. Contraindications, CI. So you should not give it in kidney, liver, problems. If the person has metabolic acidosis already, you will not give. If the person is alcoholic, you will not give. If the person has hypersensitivity to metformin, you will not give. If the person is breastfeeding, you'll have to exercise caution because it is secreted in breast milk and it can cause hypoglycemia in the baby. I'm not sure, you just check about that. Renal dysfunction, yeah, that only. Kidney problems you should not give. Congestive cardiac failure, needing drug treatment. That's what heart something. So heart also is not working, means exercise caution. Contraindicated actually. Contraindicated. Okay. Contraindications these are. Alcoholics use carefully, they are saying. Breastfeeding also I think you should use with caution. Okay, I think these are the contraindications. In a summary you have understood, right? Let's move on. So like I told you, metformin is available in so many combinations, and we already told you that it is available in combination with vitamin B. This we already told you, right? This we have told you. Wait. So metformin is available in combinations with vitamin B12 because it causes vitamin B12 deficiency itself. Atorvastatin is helping in cholesterol, so they are giving metformin. Metformin also helps in lipid profile, so both of them are going to help you manage your cholesterol. Now let's come to the combination that I mentioned here, glibenclamide and metformin. Glibenclamide is what? Sulfonylurea? Correct. Glibenclamide is sulfonylurea. You see here? And metformin is not only available in combinations with this, metformin is available in combination with all the drugs that have been mentioned here and ticked. See, it is available with glibenclamide, glipizide, gliclazide, glimepiride, then sitagliptin, vildagliptin, teneligliptin, all the gliptins, then not all, okay, some of them. Then pioglitazone, it is available in combination with acarbose, voglibose, and all these lifloxin. It's available in combination with all the drugs. So that is why metformin is very important to learn. Understood, people? But why is it available in combination with so many drugs? We'll tell you why. So now look at this treatment of diabetes. So what they're saying is, if it is type 1 diabetes, we are not giving metformin. That you know. But if it is type 2 diabetes, even as a prevention in obese, middle-aged, impaired glucose tolerance people, we can prescribe metformin along with diet and some exercise. Correct? Then, if it becomes controlled good, if it is not controlled, the diabetes mellitus, then what you do? You are going to give metformin along with one other drug. That's what they're saying here. Metformin with one drug, which could be sulfonylurea, DPP-4 inhibitors, so many things that they have mentioned. Okay. Then what they're saying is, where are we? Just here. Okay. Here. If with this one drug, if it is controlled good, otherwise what you do metformin plus 2 drugs. Okay. Understood? Some combinations they are saying here, how you should divide. Okay. Then if all this doesn't work only, then they're talking about insulin. Understood? So that is what we wanted to tell you. Even with insulin, they're giving metformin. Look at this. Look at this here. So that is why metformin is very important for you. Okay. Then for you to learn as a doctor. Now we'll come to problem-directed study. There's a 50-year-old male. He has developed type 2 diabetes mellitus. They've given you the values and all that. What is his body mass index they are telling. So he's asymptomatic. So what they want to say is, what diabetic medication will you give? I'm telling you the answer directly, metformin. Okay, because this video is about metformin, correct? So metformin therapy you will give with dietary and lifestyle measurements. And read all this content that you can see here. Hope it is clear. I'll try to zoom. Read all the thing that they have written here and learn, because metformin is very commonly used. You should know about it. Okay, bye.